afternoon, everyone. Welcome. Thank you for joining us. Today is Thursday, April 15th, 2021. We again are back today to share with you some basic information about what's happening related to COVID-19 in Eau Claire, as well as across the state, a bit of data, as well as some updates that have happened since the last time we were together. On this media call, we do walk through some of the questions that media have given to us in advance. And certainly if any of you that are on are interested in asking additional questions, you can put those in the chat box and Audrey will share those with me at the end, or you can unmute and ask questions that way. So thank you to the media for joining us and everybody else who has done so. In this space, we've had an opportunity to do weekly updates related to COVID-19. I do want to note today that in this pandemic, and unfortunately with all health issues that we have in this community and across the state, we have to face the reality that racism is a public health issue. It's part of what we as a community have to address, what our department has to address, what each of us individually has to address. There are aspects of COVID-19 that are impacted by racism. This past week, I spoke with our Hmong leaders in a really powerful conversation, and that did include their feedback that they are concerned about and worried about the way that COVID-19 has been presented in this nation, particularly as a disease connected to Asians, and the language and the really not pleasant way that people with an Asian background have had to face COVID-19. That's not okay. This is not an Asian disease. This is a viral disease. There's still a lot of work for us to understand exactly where this came from and why it has spread so rapidly. It's a contagious virus. It's COVID-19. It's not an Asian or a Chinese disease. There's also work to be done in other areas related to racism and with this specific COVID-19 pandemic. We know that vaccination rates in this community and across the state and across the country are different based on race. We need to work on that, and we are working on that in this community. We also need to continue to notice and learn about and address all types of institutional racism, things that we are seeing across the US and in our neighboring state right now. We need to work harder in order to have a healthier community and a healthier state. So today, like usual, I will walk through all of the basic data. We have now 11,361 individuals that have tested positive for COVID-19 that are Eau Claire County residents, an increase of 50 people since last week, Thursday. Average of 7 cases a day. Our goal is 10 in order to be able to manage our public health work and really to keep hospitalizations and deaths and spread as low as possible. So good that we have remained under 10 yet again this week. Our estimated number of active cases is at 79 right now. Those are people that are COVID positive and are staying home so that they don't spread COVID-19 to others. We work with them as well as their close contacts to make sure that we, again, slow spread of COVID-19. 382 Eau Claire County residents have been hospitalized related to COVID-19, an increase of 3 since last week. And we are remaining with the same number of individuals that have died related to COVID-19 that are Eau Claire County residents. So that is really very positive news. Our weekly data that we share, we continue to have about 13% of our overall cases since September related to UW Eau Claire. They do continue to do that important work of testing and following up on cases that are UW Eau Claire connected. Really important that we continue to do that. There are 12 active public health investigations. And we remain at the high activity level for the state activity level. That does mean that we have more than 100 cases in a 2-week period, and we are above that. Our trajectory of cases is flat, meaning we are not increasing rapidly, nor are we decreasing in cases. That's good news. Unfortunately, the trajectory is growing for the region and the state, and that is concerning and something that we are carefully watching. Our positivity rate is at 4.5%, and we've done about 206 tests per day. Again, trending downward. A reminder to everybody that if you have been a close contact to someone that is COVID positive, if you have any symptoms, or if you've been in situations where you don't know the status of other people that you've been in close contact with, please get tested. Again, it's our way to make sure that we slow spread. The more we can know who has COVID-19 early, the less likely that particularly the variant cases of COVID-19 will spread, which are very contagious. It is notable that the state has announced that the variant types of COVID-19 are now considered the predominant strains that are circulating in Wisconsin. Those variant types, for the most part, are ones that are more contagious and something that we need to pay attention to. Our regional hospital bed space has been good. For inpatient beds, ICU beds is in the yellow right now, and certainly we're watching that as well, as we have seen a slight uptick in some of the hospitalizations across the state and in this region. Our community spread remains in the red at 39%. And we are in the yellow for our following up on cases and close contacts. That has been continuing to be a bit of a challenge. Again, reminder that when you get that phone call, please answer it. We really want to make sure that we have good information out for those that are close contacts and that are cases of COVID-19. Given the readily available vaccine to everybody, we now have moved our vaccine measure to green. Good news, everybody over the age of 16 is able to get a vaccine, and we have ready supply right now. So good to see that right now our vaccination measure that we are tracking weekly is in the green. Do note that that measure doesn't explicitly say that vaccine is currently only allowed to be given to those over the age of 16, but we do have about 20% of our population that can't get vaccinated. So we do need to make sure that we continue to do that hard work of getting everybody vaccinated that is 16 and older. If you'd like more information on some of the measures that we track weekly and the data that's available at a local and state level, please do go to our website. So related to vaccination, we're making progress. So again, really happy to share with you that we are now close to 71,000 doses of vaccine have been given to Eau Claire County residents since the start of our vaccination efforts in this community. We have really strong vaccinators available in the pharmacy world, in our healthcare world, and of course, the health department as well. 8,853 vaccines were given since last week alone. And again, we're averaging well over 6,000 vaccines a week being given to Eau Claire County residents. 41.5% of people in Eau Claire County have gotten at least one dose of vaccine. And again, a reminder that about 20% of additional people can't get vaccine. Those are people under the age of 15. So we have a good start on where we need to get to with vaccine coverage. The state rate is at 38.5%. 29% of people in Eau Claire County have completed the series, and 81% of 65 and older have gotten one dose. 76.2% of those 65 and older have completed their series. Again, what's considered the most vulnerable group by age is, again, well on their way to getting vaccinated. We still have room to improve. There are counties across the state that are at higher rates of vaccination, and certainly our goal is to continue to move forward with that. There is a reminder today that there are vaccine appointments readily available at all of our vaccine locations. These are for Moderna vaccine and Pfizer vaccine. As you likely know already, all of our vaccinators have paused if they have received Johnson & Johnson vaccine. They are not currently giving that until we get more information from the federal and state partners that we have. It's important to know that you should not be on a wait list. So if you think you are still waiting to hear about a vaccine, don't wait anymore. Get a vaccine appointment. Go online if you are able to do that at the COVID-19 eauclair.org website. If you click on the vaccine appointment button, you will see all the options in Eau Claire County to get vaccinated, and there are many. Our goal continues to be to get everyone vaccinated that can be. A reminder that our community clinic at UW Eau Claire Zorin Arena is up and running. We have been providing vaccine there daily since last week, Thursday. That is a Tuesday through Saturday clinic. And those hours right now are 3 p.m. to 7 p.m. Eventually, we'll be expanding to 8 hours when we are starting our second doses. We are getting 3,500 doses a week, and we are putting those shots in arms every day that we've been open to date. Starting tomorrow, we also are taking more readily available walk-in appointments. Again, we encourage people to get an appointment. It is the easiest and quickest and most reliable way to assure that you have a vaccine available for when you arrive at Zorin Arena. But we do want to decrease barriers. There are some people that do have challenges with getting an appointment for a variety of reasons, that really, based on their schedule, would prefer to just walk in. And now that will be available to you. We ask people to arrive before 6:30 p.m. We will process you through as we are able to and as vaccine is available. We hope it makes it easier for some that may see it a bit of a challenge to get an appointment. If you are someone that has a challenge getting an appointment because of the online system, there is a phone number that you can call at the state that will provide an appointment for you. It's also a number that can be called if people have any language barriers. So do remind people across the community that that is available. Again, walk-ins are available, preferred if you have an appointment. Because we have Pfizer at this location, at the Zorin Arena location, it's also a reminder that this is a great option for 16 and 17-year-olds with parental consent to be vaccinated. I really challenge all of you that are parents, that are coaches, that are leaders of youth groups, to really think about how you can encourage the young people that are in your sphere of influence to get vaccinated. Parents, I encourage you to come down with your young people and get vaccinated with them. It's a great model that you can show to them about caring for themselves, caring for their family, but also importantly, caring for the community. It's a really great lesson that we can show our young people, our 16 and 17-year-olds, in real time. And I know as a parent, it's always nice to have those examples where we can just not talk to our children about caring for the community, but we can show them how we can do that. Again, you can go to vaccinate.wi.gov to make an appointment for the FEMA site, or you can call 844-684-1064. It is, the appointments are readily available, again, Tuesday through Saturday at Zorin Arena. A couple of reminders for those that are fully vaccinated. We have talked about this before, but just to walk through again, once it's been 2 weeks since your last dose of vaccine, you're considered fully vaccinated. This means your chances are much lower of getting seriously ill or dying from COVID-19. Research is also showing us increasingly that you're also less likely to spread COVID-19 to others. So if you are fully vaccinated, you can visit indoors with family members or others that are fully vaccinated with no masks. There's no recommendation that you need to wear a mask in those situations if you are fully vaccinated and your family members or that close circle in those private settings are fully vaccinated. It's low risk when you are in settings, lower risk if you are vaccinated and wearing a mask. You also can travel without a test before or after travel if you can show proof of vaccination. You can travel without quarantining after travel when you are coming back into the community. In our department, for example, people that traveled did have to quarantine for that full time of quarantine after travel before they could return to work back in our office. And that is true of all of our recommendations across the community. It's also, if you are vaccinated, it means that if you're a close contact to someone that is COVID positive, you also don't have to quarantine. It means that you won't miss work, you won't miss family events, you won't have to stay home if you are a close contact of someone that is COVID positive if you are fully vaccinated. It's important for many. I'll use an example recently where we had a sports team where people were not vaccinated, and more than 14 people had to be quarantined that were close contacts on that sport team. If they would have been vaccinated and fully vaccinated, that sports season wouldn't have been interrupted, and disease spread would be much less likely to have happened with all of those close contacts. So, lots of good reasons to get vaccinated. A reminder also for those that can't keep distance because of your work setting, because you're caretaking for a family member or someone that is requiring you to be in closer contact, because you do other activities, maybe again like sports where you are closer than 6 feet. Also, really, really important to get vaccinated. We also want to share that, yes, this is the week that Johnson & Johnson was put on pause. We have had many people in Eau Claire County that have been vaccinated with Johnson & Johnson. We and all other vaccinators in Eau Claire County have paused vaccinating with Johnson & Johnson until we hear from FDA and CDC as well as the state about the next step. They're currently looking at that. A reminder to everybody that of over really close to 7 million doses of Johnson & Johnson that were given nationwide, 6 women did have serious side effects. And we and the state and the feds are paying close attention to that. Our ask right now is that anybody that has been vaccinated in the last 3 weeks with Johnson & Johnson really monitor symptoms closely and talk to their physician if they notice any of the symptoms that are associated with the concern. Again, those are severe headache, abdominal pain, leg pain, or significant shortness of breath. Call your doctor if you experience those symptoms and within the last 3 weeks did have a Johnson & Johnson vaccine. Know that all of our vaccinators are still getting supply of vaccine with Pfizer and Moderna. This blood clot side effect has not been associated with either of the other 2 types of vaccine that we have in Eau Claire County and across the US. They're made using a different process, and our vaccines are really considered safe. So please, this is a pause in Johnson & Johnson. Please don't have it be discouraging to get a vaccine. Find another appointment if you had a J&J appointment and get vaccinated as quickly as possible. So a couple of questions from the media in advance. I'll address those and then certainly we'll open for questions after. So the first question is related to Zorin Arena. Will Pfizer continue to be the only vaccine offered at that clinic? Yes, we understand from the state that the vaccine that will be provided for Zorin Arena, the 3,500 doses a week of first doses, will be Pfizer vaccine. Again, the positive of that, not only is that the supply is available, but anybody 16 and older can be vaccinated with Pfizer. It is the only vaccine available in the US that can be vaccinated with 16 and 17-year-olds. A reminder that this location will not have other types of vaccine available. So if you got your first dose of Moderna somewhere else, you need to go back to that original vaccinator and get your second dose there. If for some reason you are not able to get your second dose of Moderna at the site where you got your first dose, do check our website, and there is information on the website about who else may be giving Moderna, where you can get that second dose in the time that you need to get it. So we have a couple of questions related to opening up walk-ins to the Zorin Arena site. So I'll walk through that a little bit and talk about the reason that we made that decision, as well as any concerns that may be connected to that decision. Last week, when we opened the clinic and continuing through today, we do have our appointments booked, the 700 doses a day. We have had really good response to that. We also know that there are some people that do have some barriers to getting an appointment, and it may be because they have a variable work schedule. It may be for a variety of other reasons. And we really saw an opportunity to take walk-ins and have that be less of a barrier for those that really couldn't make an appointment easily. We still strongly recommend an appointment. We do have appointments available at the end of this week and next week. And we recommend that process. We do have openings on Friday and Saturday, so we did make the decision to open up walk-ins already for Friday. Other vaccine sites around the state are doing this, and they really see this as a way to make it simple for people to get vaccinated. And it's been a strategy that's been utilized in other locations, and we made the decision to move forward with that this week. We also know that we have our processes in place now with a week under our belt with running this clinic, that we can manage those walk-ins a little bit easier. When we first opened, we talked about doing walk-ins right away and decided that first we wanted to make sure that we had our processes down more smoothly before we added that to the mix. We also were asked a little bit about whether or not there were any negative ramifications to this, or whether we were concerned about people utilizing this site. We've seen supply and demand to be about equal. We are working on a variety of strategies to make sure that demand remains strong, and walk-in strategy is one of those. This is also a regional site, so we are working across the region to make sure that people have access to this location all through the week. We also need to make sure that we don't waste vaccine doses, and certainly adding walk-ins to the mix and making sure that at the end of the clinic day that we use all of our doses that are in each vial that we open is critically important. We won't take walk-ins likely after 6:30, so if you'd like to try a walk-in appointment, please get here before 6:30. We will complete the vials we have at the end of the night and not open any additional vials for any walk-ins that may be waiting. We do a lot of work to make sure we minimize wastage, as do all the vaccinators across the state. It's an important part of the work we do. At the end of the night, we are looking for people sometimes to add those last couple doses to make sure that we don't have, out of our 6-dose vial, any that are wasted. So also a question about getting to herd immunity with our 41% of our county that has gotten at least one dose. Again, a reminder that 41% is a good start. We are above the state rate, and we are above the rate of many states across the US, but it is just a start. Adding to that 41% is the 20% of people that currently aren't able to get a vaccine because they're under the age of 16. We do still have a ways to go. We're counting on people in Eau Claire County, and we're frankly confident that people in Eau Claire County will see the value to the community in getting vaccinated. Our Chippewa Valley Economic Recovery Task Force, that partnership with businesses and governments across Eau Claire County, talks about this a lot. How do we find shared value in having high rates of vaccination? And that group, as well as partnership groups across Eau Claire, really are focusing on this being something that is important to the individual and to the family when we have that protection, but really important to our community. We can't afford to have space in our number of people that have been vaccinated to have the variant strain get established before we get enough people vaccinated. We're seeing what's happening in Michigan right now, and we can't afford to have that happen in Wisconsin. We need to keep working together to remove barriers and to answer questions about hesitation. You can all help us with this. We have heard that there are appointments available with all of our vaccinators. So now our work is cut out for us to really get people to the clinics that exist. Really reach out to people that you know to make sure that they have an easy way to get vaccinated. We also are working hard to find different strategies to get vaccine into arms, not just the Zorin Arena site, but going on site in various locations, including employment sites, including spaces where vulnerable populations are that may have barriers. We went to the Hmong Mutual Assistance Association this week on Monday, for example, and vaccinated there. So, lots of work to do, together, and a really, really good start with 41% of our population already having received at least one vaccination. We do have concern, and we're counting on all of you to work with us in getting to that higher rate of vaccination that we need. So a couple of questions about Johnson & Johnson. Should people that already have gotten the Johnson & Johnson vaccine be cautious about anything right now? Is there anything extra that they should be doing? So first of all, a reminder that this is a very, very rare side effect that has been seen with Johnson & Johnson. The pause was put in place because it was a symptom that was larger than what we would otherwise expect, and is important to take a pause and study. That's what we do in the science world, is take a look and see what is going on. The pause is happening so the FDA and CDC can do that. But again, it's very rare. We are not aware of any cases of this happening in Wisconsin nor in Eau Claire. What we do ask people to do that have gotten vaccinated with a Johnson & Johnson dose in the last 3 weeks is watch for symptoms. Again, what I shared earlier, the severe headache, abdominal pain, leg pain, significant shortness of breath. Talk to their doctor if they have symptoms. I had my son and his significant other be vaccinated with Johnson & Johnson last week at our vaccination clinic, and they're monitoring their symptoms. And I advise him and advise all of you that if you receive Johnson & Johnson, again, this is very rare, and pay attention to symptoms so that we are tracking those. Talk to your doctor if you are concerned. Anybody that received Johnson & Johnson more than 3 weeks ago, the risk is considered extremely low of any side effects or any of these untoward effects happening. Also related to Johnson & Johnson, a question about whether we anticipate any setback for vaccination. The volume of Johnson & Johnson was smaller in Wisconsin than the other two types of vaccine. About 90% of our vaccine statewide is Pfizer or Moderna. We did get a significant volume of J&J into Eau Claire County related to vaccinating some of our populations, like our teachers and others. But we don't have a lot of Johnson & Johnson available in the US at this point in time anyway. We don't think it will be a significant setback, but of course we are eager to see what FDA says. It is an important vaccine because of its being a one-dose vaccine, and we see need for that type of vaccine if we are able to continue to use it. So then the final question, maybe not the final question. We do have a question about the employer-based clinics. So as I shared earlier, we are starting with employer-based clinics, as are some of the other vaccinators in very small ways already. We see this as an important strategy. If we can make it very easy to get a yes from people to get vaccinated by going on site and making it simple for them, we are willing to do that. Vaccine volume is an important part of our ability to do that right now. We are not getting a lot of vaccine available to do employer-based clinics, but we are working through talking to employers. We are setting up some of those clinics. We started that last week, doing a couple smaller employer-based clinics. We will have more next week, and we will keep moving forward with that as we have vaccine available. Again, our goal with this and our goal with our other mobile vaccination clinics is to really make it easier for people to get vaccinated in this community. We also had a question about people getting COVID-19 after getting vaccinated. Again, I would remind people that This vaccine is meant to prevent against serious illness and death. No vaccine is 100%. None of our vaccines that we currently have available is at 100%, although COVID-19 vaccines are very, very close to 100%, which is amazingly positive for all of us. It's not unexpected to have a few cases crop up of people that are vaccinated. It's been under 10 so far in Eau Claire. That small number is being reviewed at the state level. Anybody that's vaccinated does get forwarded to the state if they are a case, and we are certainly watching that as well. This is a really effective vaccine. It is still really important that people see this as a way for us to move forward as a community. When you get a COVID vaccine, does it prevent or decrease your immune system from fighting other viruses or illnesses? Is also a question. So, no, vaccines don't weaken your immune system. They actually stimulate your immune system related to that specific virus. Your body sometimes responds by having symptoms like fatigue or fever or aches, where people may think that their immune system is doing the wrong thing. It's actually that our body's immune system is responding to the vaccine and really helping us so that if we get exposed to COVID-19 later, it can respond even in a stronger way. It does not decrease our immune system from fighting off any other diseases. So with that, I will ask Audrey if there are any questions in the chat box.
Chat box is empty today. Is anyone interested in unmuting and asking a question directly?
All right, with that, I will say thank you. We appreciate you joining us to get information and updates. A reminder to go to the COVID19eauclair.org website. There is a lot of good information there. You can also call our call center. We have people there that have a wealth of information and can walk you through things that you either were confused about on the website or you have additional questions about. That number is 715-831-7425. We'll be back next week, Thursday, to share more updates with you then. Thank you.